We're here in Methley Park. We're doing a cosmetic surgery course with the support of Motiva, and we're training the plastic surgeons of tomorrow how safely to proceed to cosmetic surgery and breast augmentation to their patients. The challenge is whatever you have in your mind, the patient to have the same. So that sizing system helps quite a lot for you to figure out what kind of implants you're going to use. Usual questions that we get from the patients: I'm going to use a round implant or an anatomical one. This is a very common question because most of the patients want to look natural. We used to have that problem in the past. The advantage of these implants are that they're still round, but once the patient sits up, they're behaving like natural breasts, so they're giving the teardrop natural shape to the breast. At the same time, because the implant is soft and natural, to the patient feels like as good as it gets, close to being a natural breast. The other thing is you have to measure is the distance from the nipple to the IMF. So that distance without any stretch is 7. It's in good proportion. The lower pole is fine. We'll see it on table and we stretch a bit, but you need to do minimal drop of the IMF. All right, good morning, everyone. Briefing for the two first patients. First one is a bilateral breast augmentation. We're gonna need some betadine and antibiotic wash, change the gloves when we're gonna change the implant. Okay, happy? Yeah? Everybody okay? All right, let's do it.
White waistband, no allergies.
Okay, being considered for bilateral breast augmentation, signed by myself and signed by the patient. Now, we talked about the stretch a bit. We talked about the curve being around 8. Stretching is about 7 and a bit. Okay? Happy to start, Rama? Okay, have a look. Before you start seeing fascia, you don't want to go deep to that. Okay, your breast, you don't want deep to that, just on top. It's quite crucial. Actually, I take my time at this point just to make sure you find the right plane. As I said, especially with the ergonomic implants, your pocket needs to be tight, all right? So you don't want over dissection. So we have dissected the pocket for the implant to go in, just between the breast and the muscle. And we're gonna try a sizer to see that the implant is the right size, and then we're gonna put the final implant at the end. We have chosen to go for the 335 ergonomic 2 implant in order to give the patient the volume that she wants, but as well a natural look that she's after too. To minimize chance of infection, we change gloves before inserting a new implant. We're using a funnel that will allow the implant to go in and travel under the breast. At the same time, we're using betadine wash and antibiotics, but as well, we're covering the nipple with nipple shields to minimize the chance of infection. Okay, we finished the breast augmentation and the incision is closed, and we're measuring the length of the incision, which is less than 3 centimeters, and we're moving to do the next one.
The masterclass is a really great opportunity for us as trainees to get a bit more experience of aspects of plastic surgery that we don't maybe have as much access to in the NHS.
You need an instrument that is expandable, so as you're going further, muscle, yeah? And you just carry on into that plane, yeah?
I've really enjoyed watching the dynamic between the surgeon and patient. Then on the technical side, it's of course been a huge learning opportunity for me to watch Mr. Lymperopoulos operate.
Biggest take home today has been for me for comparing the different types of implants, how they can be used for different cases, especially comparing the ergonomics to the other types of implants that Motiva have.
So I'd say the biggest take home is just learning, Mr. Lymperopoulos's preference of, surgical technique for both of these operations. Training, it's really about getting exposure to these kind of cases as much as possible.
Really great opportunity to see a cosmetic side of things, especially with the breast surgery that we've seen. We've seen 3 great operations being taken through from start to finish, learning step-by-step techniques and little nuances that we can definitely take away and use in our own practice.
As you can see, we have made a natural breast, a good curve, looking a natural look, and have given the patient what she wanted, and as well a very small incision. By the end of the operation, we're doing a block to block the nerves under the pectoralis muscle, and that will allow the patient to wake up pain-free. So it has been a great day. We combined the technology of the future and as well our experience to train the surgeons of tomorrow how to treat patients and to give them safe and predictable results.